So let's talk about why pharma companies absolutely have to check themselves. Today, we're diving into the power of something called self-inspection. Now, this might sound a bit dry, but trust me, it's the ultimate safety net, the very backbone of quality that stops catastrophic failures before they ever happen. It's one of the most critical parts of making safe medicine, but it's something most of us never even hear about. Okay, think about it like this. What if a pilot, right before takeoff, just decided to skip the fuel check? You wouldn't just call that a mistake, right? That's serious negligence. Well, in the world of pharma, a tiny error in just one dose could impact thousands, even millions of lives. So an oversight like that, it's not just negligence. It's an absolute catastrophe waiting to happen. The stakes just couldn't be higher. And that really gets us to the core problem here, which is just how high those stakes are. The unacceptable mistake. You see, the entire industry is built on a standard that has absolutely zero room for error. We're talking about a world of absolutes. So that leads to a huge question. In an industry where safe enough just doesn't cut it, how on earth do you guarantee perfection? I mean, how do you make sure that millions, literally millions of pills and vials are completely flawless every single time? The pressure is, well, it's just unimaginable. Well, the answer isn't what you might think. It's not about waiting for a regulator like the FDA to show up with a clipboard and find something wrong. No. The best companies, the safest ones, are the ones who are constantly proactive. They're not waiting for someone to knock on their door. They are knocking on their own door first, trying to find problems before anyone else even gets a chance. And that idea, that proactive knock on your own door, that's exactly what we're talking about today. It's called self-inspection, the internal mirror. You can think of it as the discipline of holding a mirror up to your own operations. The whole point is to find the flaws long before they could ever become a real danger to anyone. So let's get into the nitty-gritty. What is self-inspection exactly? Well, according to the World Health Organization, it's basically an internal audit. And the goal is pretty straightforward. You're checking to make sure your own company is following all the rules of what's called good manufacturing practice, or GMP for short. And this covers, well, pretty much everything. And I want to be clear, this is not just some quick walkthrough with a checklist. No way. This is a forensic deep dive. We're talking about key areas like personnel. Are they trained properly? The premises and equipment. Is everything clean? Is it maintained? Documentation. Is every single record perfect? Sanitation, hygiene, production, quality control, you name it. Every last detail gets put under a microscope. You know, maybe the best way to think about it is like a mock exam before the real thing. If you find a mistake on your practice test, what do? You fix it. No big deal, no penalty. But if you wait, and the official examiner, the regulator, finds that exact same mistake, oh, you don't just fail. You get a formal, very public, and very expensive warning letter. It's a huge deal. And you've got to understand, this isn't just a nice-to-have or a best practice. It is a non-negotiable global requirement. It is not optional. And yeah, the rules might be a little different depending on where you are in the world, but they all point to the exact same thing. So if we look at the big global regulators, you can see they each have their own little focus. In the EU, they're really big on the people doing the inspection. They have to be independent and competent. Over in the US, the FDA is, famous for its obsession with paperwork. They want rigorous records, constant reviews, and then you have international groups like PICS/S that are all about creating standardized checklists so everyone is on the same page. So you see, slightly different angles, but all aiming for the same goal. But if you boil it all down, it comes back to one simple, powerful idea that everyone agrees on. You can't grade your own homework. It just doesn't work. The person who's actually responsible for doing something can't be the one to inspect it. It's common sense, right? For an audit to actually mean anything, you need a fresh, unbiased set of eyes. That's the only way to get real objectivity. Okay, so we've covered the what and the why, but how does this all actually work in the real world? Well, it's all about a continuous 4-step cycle. First up, you've got the plan. This is where you create an annual schedule, and you're smart about it. You prioritize the areas with the highest risk. Step 2 is the audit itself. This is the hands-on part, walking the floor, talking to staff, digging deep into the data, and checking on previous fixes. Then, step 3, the report. You document everything you find, and you assign a clear risk level to it. Is it critical, major, or minor? But honestly, those first 3 steps, they mean nothing without the fourth and most important one, the follow-up. You absolutely have to track and verify that every single issue has actually been fixed. If you don't, the whole thing was just a waste of time and some very expensive paperwork. And this is where we get to the real heart of the matter. Because the ultimate goal here It isn't just about ticking a box to keep a regulator happy. It's about something so much bigger. It's about changing a company's entire mindset. It's about building a genuine culture of quality from the ground up. And really, there are two totally different ways this can go. On one side, you have what you could call the gotcha game. This is where inspections are all about pointing fingers and finding someone to blame. And of course, in that kind of environment, people are terrified to report mistakes. That approach just doesn't work. But then you have the other side, the collaborative tool. This is where the focus is on finding solutions, not blame. It's where people feel safe and open about finding ways to improve, and where quality becomes everyone's job, a shared ownership. And this is the critical shift in thinking. A truly mature quality culture, it stops asking who made the mistake. Instead, it gets absolutely obsessed with asking why. Why did our system allow this mistake to happen in the first place? And once you figure that out, you can fix the system for good. And you know what? When a company actually makes that shift, when they move from just checking boxes to a real culture of ownership, something amazing happens. The risk of a product recall, which is like the ultimate nightmare for any pharma company, it drops to near zero. It practically disappears. So in the end, that's what self-inspection is all about. It's that internal mirror. It's the tool that lets a company be brutally, unflinchingly honest with itself. It's about finding your own flaws and fixing them, long before they ever have a chance to harm a patient. It's about integrity, it's about safety, and it's about never, ever stopping the pursuit of improvement. And that really leaves us with one final, and I think crucial question. And you can ask this about any system, really, in any industry. Is your quality system a real mirror for improvement, or is it just a checklist for compliance? Because believe me, the answer to that question, it changes everything.